Magandang umaga po sa inyong lahat. Good morning to everyone. Natutuwa ako na makasamang muli ang CESB community. I am also pleased that the organizers have included a topic on mental health in this leadership conference. As leaders in your respective circles of influence, you would be able to do so much to enhance people's mental health and well-being. I also would like to acknowledge the title that was given by the organizers to our discussion for this morning. It is okay not to be okay, well-being for everyone. The title certainly carries an affirming spirit, which points to a growing realization among the alert sectors in our society that being aware and accepting of mental health issues is certainly okay. So it is in harmony with this positive tone of reference to mental health that I will now discuss the following topics: the mental health law and its significance, what mental health is, some observations on the state of mental health in the country, and what government leaders can do to serve the mental health movement within their areas of influence. So let's take a look at the mental health law. In June 20, 2018, the President signed the Mental Health Bill into Mental Health Law, or RA 11036. It took almost 3 decades to give birth to this law. As early as 1989, a Mental Health Act was introduced by Senator Orlando S. Mercado. Since 1989, other bills were filed and lobbied for. An executive order was made on mental health. Noteworthy in the process is the commendable initiatives of stakeholders in the drafting and lobbying for the mental health law. The bill that is now a law went largely unopposed, since it came when we were becoming more acutely aware of how mental illness was making the lives of many people miserable. During that time, the local media featured stories about attempted and committed suicide among the famous and the not so famous personalities. There were also global and local statistics that point to the growing seriousness of mental health problems here and abroad. For instance, in 2017, WHO's fact sheet indicate that depression is the second leading cause of death among the younger population ages 15 to 28 years old. WHO's 10 facts on mental health tells us that around 20% of the world's children and adolescents have mental disorders or problems, and about half of mental disorders begin before the age of 14. In 2011, WHO conducted a global school-based health survey, which included the Philippines. Focusing on the results of the survey on the Philippine sample, we note that 16% of students between 13 to 15 years old have seriously considered attempting suicide during the past year, while 13% have actually attempted suicide one or more times during the past year. Looking now at national data on adults with mental health problems, we note that the Philippines has the highest incidence of depression in Southeast Asia. 7 Filipinos commit suicide every day, and 32% of sampled Filipino government employees in a study in Metro Manila workplaces have experienced a mental health problem in their lifetime. Given such context, the passage of the law was a cause of rejoicing for Filipinos and international proponents of human rights and mental health. After all, the Philippines is the last country to pass a mental health law in Southeast Asia. The law also honors our commitment to several international covenants. It was also in tune with the statement of APEC in its 2017 meeting, acknowledging the significant economic benefits of a mentally healthy population. Now, let's take a look at the key features of our mental health law. One, the law declares that Philippine society values mental health. In Chapter 1, Section 2, we read in the Declaration of Policy that the state affirms the basic right of all Filipinos to mental health as well as mental health services. So let's remember, mental health is a right, not a luxury nor a privilege among a minority group. Secondly, it is very clear that the law is for all Filipinos, okay? However, some people believe that mental health law is only for those with mental illness and those who are practicing professionals in the field. Now, given the definition of mental health in the law, we can see that RA 11036 is for all Filipinos. Here is our definition of mental health in RA 11036. It states there, mental health refers to a state of well-being in which the individual realizes one's abilities and potentials, copes adequately with the normal stresses of life, displays resilience in the face of extreme life events, works productively and fruitfully, and is able to make a positive contribution to the community. Most certainly, from this definition, we could see that mental health is not simply the absence of mental illness. It is about well-being concerns like having positive attitudes and emotions, the capacity to live a full and creative life, and the ability to connect meaningfully and to thrive even against all odds, including the pandemic. Now, most definitely, these are all concerns for all Filipinos. And this is what RA 11036 commits the government to promoting and protecting. Thirdly, the law addresses treatment as well as prevention and growth concerns. More specifically, it states that timely, affordable, high quality, and culturally appropriate mental health care, which is responsive to psychiatric, neurologic, and psychosocial needs, will be made available to the public. Now, from our experience, we know that it's so hard to find mental health professionals in the places where we could go to bring people with problems on mental disorders. Now, with the mental health law, this may no longer be a problem. It states mental health services shall be established at the community level where there will be mental health professionals, support staff, trained barangay workers, and volunteers. It also stipulates that all regional, provincial, and tertiary hospitals, including private hospitals, shall provide psychiatric, psychosocial, and neurologic services. Okay, the law further stipulates each local healthcare facility must be capable of conducting drug screening. Mental health services shall also include mechanisms for suicide prevention, intervention, and response strategies, especially for the young population. And there will be heightened nationwide multimedia campaign to raise the level of public awareness on the protection and promotion of mental health. We also have to underline the fact that RA 1136 is a rights-based law. As such, it supports the rights of service users, their family, and those of the mental health professionals. With that in mind, then the mental health service users can expect freedom from social, economic, and political discrimination and stigmatization, equality in access to mental health services, humane treatment will be guaranteed, confidentiality of all information, communication, and records will be protected, and a channel for presenting complaints will be made available. The law also mandates that the state shall ensure the integration of mental health into the educational system. Now, this means that the educational institutions such as schools, colleges, universities, and technical schools shall develop policies and programs for students, educators, and other employees designed to raise awareness on mental health issues so that people will be knowledgeable about mental health, identify and provide support and services for individuals at risk, and facilitate access, including referral mechanisms of individuals with mental health conditions to treatment and psychosocial support. The law also mandates that mental health be protected and promoted in the workplace. This means employers, both in public and private domains, shall develop appropriate policies and programs on mental health in the workplace that target the same goals that I have mentioned for the educational system. Now, many things are going to happen, many changes are going to take place in providing mental health services. So it does make sense that the law also requires mental health providers to undergo capacity building, reorientation, and training to develop their ability to deliver effective mental health services. Okay? Now, research has always been a problem, especially in mental health area, because there's not much funding on the subject. Now, the law stipulates that research and development shall be undertaken to formulate and develop a culturally relevant national health program. The law also stipulates that leadership for the mental health movement will be provided by the Philippine Council for Mental Health. It shall be established as a policy-making, planning, coordinating, and advisory body attached to the Department of Health to oversee the implementation of the law. A mental health division shall also be created under the Disease Prevention and Control Bureau of DOH, which shall implement the National Mental Health Program and also serve as the secretariat of the council. Now, to put teeth into the law also includes a provision for consequences to serious violation of its provisions. Appropriation is also provided for the implementation of the law. The amount allocated for mental health in the DOH budget and in the budget of other agencies with specific mandates provided in the Act shall be based on the strategic plan formulated by the Council in coordination with other stakeholders. Okay, so you could see we have a very good mental health law. But just like any other kind of law, its provisions will need to become incarnate. So now let's take a look at the challenges that will be faced by leaders in supporting the mental health movement in our country at the present. Okay, so our leaders would need to accelerate work on developing mental health policies, structures, programs, and services because the pandemic, with its tremendous stressors, has caused further escalation in the incidence of mental health related problems in the country. In a longitudinal study among adults, with nationwide sampling in the US, researchers found out that in general, people reporting increased symptoms of depression have tripled during the pandemic days. They have also found out that elevated depressive symptoms were most prevalent in four groups: the younger patients, people with low income and savings, and unmarried people. Basically, the same observations here in the Philippines. DOH have also provided us with local statistics that helps us to appreciate the seriousness of mental health problems during the pandemic. DOH reported that the number of calls to the government's hotline for mental health assistance continued to increase in 2021. For instance, in March, they registered a total of 1,604 calls. And by the month of April, it has escalated to 1,805. And around 31% of the calls made in April are about anxiety and depressive symptoms. DOH also reports a survey conducted with 1,879 Filipinos, okay? And in this study, okay, conducted online, they found out that 1/4 of respondents reported moderate to severe anxiety, and 1/6 reported moderate to severe depression and psychological impact. DOH also reports that contracting COVID-19 also affects a person's mental health. In a study, they noted that 1 in 3 COVID-19 patients are diagnosed with neuropsychiatric condition in the 6 months after contracting COVID. Now, at UP Diliman, through PsychServe, okay, we also offered telepsychotherapy services to the public. And we did content analysis of the cases that were brought our way, and we found a common list of problems that are usually brought for telepsychotherapy. This includes anxiety about what the future holds, fear over being infected or infecting others, especially with the new variant of the virus, overwhelming stress from varied problems, financial, work, study, etc., sleeplessness, ang hirap matulog, boredom, loneliness, and depression that social distancing and the quarantine brings, demotivation, lowered performance, both at work and in school. Family conflicts and domestic violence have risen, and also existential issues represented by questions of clients such as, may Diyos ba? Nakalimutan na ba kami? Anong kahulugan ng buhay sa panahon ng pandemya? Now, many of these problems, and this is the good news, do not reach diagnosable level. As also indicated by the DOH study, only 1/4 were seen to be serious, moderate to serious cases of anxiety, and 1/6 that of depression. So the rest may be referred to as normal reactions to abnormal situation. However, though many of the concerns that may come our way are normal reactions to abnormal situations, they are nonetheless disturbing and can erode the sufferer's resilience. There is thus the need to help these people find ways of taking care of themselves so that these disturbing reactions do not develop into serious mental health conditions. Loneliness does not develop to major clinical depression, and marital conflict does not lead to hiwalayan and maybe even annulment. There is also the need to support an already sizable number of people in our midst who are already experiencing serious mental health issues, the 1/4 and the 1/6 cases, as mentioned by DOH. And there is also the challenge to keep the healthy normal and to help the whole population, those with diagnosable conditions and those without, to find growth and enhanced well-being even in the midst of the pandemic. Another major challenge in mental health field that confronts us and our leaders is the lack of mental health professionals. To date, we only have 548 practicing psychiatrists, 1,500 registered psychologists, 4,069 registered guidance counselors to serve the entire Filipino population of 110.7 million. To address the human power issue, we need to graduate more mental health professionals and train and mobilize the lay and para professionals. Now you could see on the screen a pyramid. We refer to it as the pyramid, the intervention pyramid in mental health and psychosocial support work. Now, what does this pyramid tell us? It simply tells us that there are many things that need to be done in the field of mental health work, but not all needs to be done by mental health professionals. Many of these activities could be engaged by trained paraprofessionals and lay volunteer workers. We still need to produce more mental health professionals, and for us to be able to do that, our leaders can help support universities within and outside Metro Manila to establish consortia. They come together to help recruit and graduate more students specializing in mental health. We need to provide scholarships and institutional support to encourage students to enter into this particular field. And our leaders also need to support the design and the running of training programs for workplaces and communities so that allied medical practitioners like dentists and nurses, teachers, church workers such as priests and pastors, human relations officers and volunteer employees in workplaces, the police and the military, and the community people can all become mental health advocates and providers of basic psychosocial support work. Educating the public is a very big challenge for us and our leaders. And one concern has to do with lack of knowledge and language by which we talk about mental health. We find lack of understanding and clear language for talking about mental health to be a major challenge. People have very limited knowledge of mental health. Many do not even know the difference among the various kinds of mental health professionals. Pag pumasok ang problema ng mental disorder sa ating buhay, marami ang hindi nakakaalam kung kanino pupunta, sa psychiatrist ba, sa psychologist o sa counselor. The language to refer to key concepts in mental health seems also to be forced, not resonant with our everyday life experience, and seems just good for academic discussion. Who would use lusog isip to talk about one's own mental health? What is the universe of discourse covered by the realm of mental health? A survey done in workplace during the pandemic noted that employees and even leaders talk about mental health concerns only rarely. Bihirang pag-usapan ang mental health sa opisina, sa workplaces. Now, aside from the problem of stigma, another reason for this reticence is the lack of language and knowledge to talk about the subject. Now, this concern brings us to another major concern in educating the public: the limited notion that mental health is merely the absence of mental illness. Pinag-uusapan pa natin yan kanina. One can sense this stereotype thinking during celebrations of Mental Health Day or month. Schools, churches, and workplaces would target awareness raising by sponsoring talks on common mental health issues such as depression, suicide, anxiety, and other types of mental disorders. But mental health is also bolstered by addressing well-being concerns. And I've listed here a number of well-being concerns that can be addressed in such fora, such as creating happiness in life, enhancing relationships, even nurturing spirituality. Certainly, well-being concerns should also include looking at problems of living na mabigat, mahirap, but are not mental disorders or psychiatric in nature. Examples of this would be grief and losses, boredom and meaninglessness, emotional reactivity, demotivation, and high turnover in the workplace. Sana ang ating leaders merong ganito ring lawak ang lalim ng pag-appreciate kung ano ibig sabihin ng pagtatrabaho sa mental health field. Another concern for educating the public is that of stigma. In February 2021, a poster to promote the movie Tililing came out and drew criticism from different groups. Different groups argued that the poster stereotypes people with mental health problems as downright lunatics. In the Philippines, there is still much stigma attached to mental health. It is fortunate that many groups are vigilant and responsive in calling out events that tend to perpetuate mental health stigma, even those without malicious intent. For instance, in relation to the Tililing posters, the Commission on Human Rights of the Philippines, CHR, released a strong statement about the Tililing poster, bearing an image that relies on negative perceptions of Filipinos living with mental illness. So, we need leaders with sensibilities regarding the protection of people from stigmatization and discrimination on the basis of mental health issues. And who would ensure that such sensibilities are practiced in different aspects of our life, such as employment and work promotion, access to care, mode of treatment, family and community life, and even political and legal concerns. Now, mental health may also need to rise higher in the order of values at the personal, family, community, and organizational levels. If asked what they value most, Filipinos would probably answer God, family, and work. Not many would mention mental health, well-being, or related states, such as peace of mind and resilience. At the September 18, 2020 hearing on the DOH budget allocation for the National Mental Health Program was pegged at 615 million pesos, equivalent to 5.69 pesos per capita. Now, House Representatives Kimbo and Suntay stated that such is grossly insufficient to respond to the mental health needs of Filipinos. Totoo naman talaga. And asked for an additional 1 billion pesos. So, we need leaders who are passionate about mental health, monitoring developments on budgeting, policy formulation and programming, and advocating for sound approaches and decisions. So many things need to be done to bring wellness and wholeness into the lives of our people. And for that to happen, we need to have integrated, coherent, evidence-informed, and culturally sensitive approach to mental health work. Thank God, the Philippine Council for Mental Health has done their assignment and has put together and adopted a national mental health strategic framework for the next 5 years. So focusing on mental health and well-being of the Filipinos, the strategic framework would target improvement of programs on prevention and promotion of mental health. It would enhance information system and research work. It would enhance effectiveness of mental health services and support efficient governance of mental health programs. All these activities would be guided by the following approaches. The more biopsychosocial approach that addresses the tendency in the present to be more medical and clinical in our orientation to helping people with mental health problems. It would focus on a more balanced care approach. It would emphasize mental health programs being more rights-based, and it would definitely be recovery-oriented. The mental health program would target the whole of society, engage the whole of the government in developing a competent and compassionate health system. It also carries a framework for capacity building, okay, which would target improvement of government governance and leadership, improvement of mental health information systems, and improvement of mental health services. Let me just give a short discussion on 4 elements of the framework that I think are worth noting of. One is the framework puts emphasis on reorienting, reframing, expanding our understanding of mental health from a more clinical illness orientation to one that addresses the well-being of the whole population, which includes the normal and the healthy. Two, the framework is more integrative and is referred to as biopsychosocial spiritual framework. It is expected to remedy the neglect of the psychosocial and spiritual dimensions in understanding and dealing with mental health issues. Three, the framework is systemic in the sense that it highlights how social cultural factors affect the mental health of an individual. And lastly, the expanded view of mental health and the more integrative character of the framework is saying that the pursuit of mental health is not only the concern of the sick and the mental health professionals, it is everybody's business. And so we need leaders who are able to rally different sectors of the society, of the community, for concerted action for mental health. Now, the need to pursue cultural relevance in mental health is a big challenge. It is not about nationalism, no, 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 but more about validity and subsequent effectiveness of our interventions. We would be most able to facilitate personal and whole system change if our concepts and interventions resonate with the psyche and cultural realities of our people. Ang malungkot lang, we note that there is still strong reliance on Western models in addressing mental health concerns. I once attended an introduction to a mental health service that a group wants to offer for free to the community. The group must have spent money to pay for the services of the consultant. I was appalled that the service program being offered has many loopholes and that the consultant was not even a mental health professional. I guess what got the group excited in bringing the service to the community was that it was developed abroad. Ika nga, stateside. So lastly, we need leaders who have the vision of seeing their people experience wellness, wholeness, growth, and healing, and would have the diligence to educate themselves on the science and management of mental health, as well as the wisdom in choosing people who will work with them in making their vision come true. So thank you for your invitation and for being here with me in this morning's session.